Hello, I am speaking Dr. Deshbandhu Vajpayee from Kanak Polytherapy Clinic and Research Center, 67/70 Bhusatoli Road, Bartan Bazar, Kanpur, Uttar Pradesh, India, and is before you. Today I will tell you about a patient situation who was suffering from severe hepatitis A and was treated by me in integrated manner. The diagnosis was done in integrated way, keeping in view the allopathic view of hepatitis diagnosis and Ayurvedic view of hepatitis diagnosis and Unani view of hepatitis diagnosis and homeopathic view of hepatitis diagnosis all together simultaneously, and to conclude the diagnosis and after the treatment strategy is taken in consideration that how patient is responding well with the Ayurvedic, homeopathic, Unani and allopathic medicines simultaneously being used for curing of the situation which patient is having. So altogether electrothrombosurgery is used for the status quantification of the Prakriti Tridosho and Saptadhatu, Vata affected Saptadhatu, Pitta affected Saptadhatu, and Kaph affected Saptadhatu. So 28 numbers of dhatus are considered, and combination of Prakriti and situation of Tridosho at 7. After that, Agni and Mal is also considered. Again, we see the Sroto Dushti and the including Dosh Vikrati and Karya Vikrati of the patient body and other factors we check with the electrothrombosurgery results overall. So the three positions of electrothrombosurgery is recorded. The first one is the rest position, in which the patient is in horizontal position lying on the couch, and recording is done in this position. The second one is the exercising position, now which you are seeing here. The patient is cycling and the machine is being shown here. This is the exercising position for which we recording the electrothrombosurgery recordings, and after that we consider it, and the matter, the recording matter goes to computer, and the computer recorded, analyzed and synthesized each and every waves and recorded material. Then the software which is in computer analyzes and synthesizes the whole of the systems in categorical, as I have already told you about the Ayurveda principles, status quantifications in so many factors and segments. So Prakriti, Tridosh, Saptadhatu, Mal, Agni, and five Vedas of Vat, total 15, and Srot, Dushti, Karya Vikrati, or and uh, other factors are taken in consideration for the patient analysis, and in this way the homeopathic concept of psoriasis psychosis is also taken in consideration with the Vat Pitta Kapha and Unani factors Saudavi, Sifravi and Najlavi is also taken simultaneously in the context with the allopathic view of the uh, disease condition to be taken in consideration, and we consider all the factors whatever they may be in the rest position and in exercising position. Now the third position is the rest position for the very long period. We have collected the urine of patient, which is now you are seeing here, that is of the coffee color and is very dark. So you can imagine the level of bilirubin and bile juice which is mixing in the blood and coming out with the urine in which position. So you see the color which is very dense in nature, and you can see the severity of the hepatitis level of this patient, and how the condition is liver and how will be in the blood. So we will test it and let us see how much bilirubin level is going on, and what will be the count of bilirubin in the blood and in the urine. So now we are testing here. Here is the strips, and you see this is the normal strip, and the other one is the colored strip. So the colored strip you are seeing here. In the next one, how it is responding in the color level. So you see the next one and compare it. So in the comparison we see that there is so many anomalies which is very dense in a very serious level. You see here the all together the protein is now and glucose is not in the mixing in this one, but the other factors are very serious in this condition. The pH level is looking now normal, and the protein uh, protein is now passing, but the glucose is normal, and there is no significance in seen in glucose level. Now you see the strip condition and showing the color here. So this is the condition of the liver, and the output of urine is showing here in this strip. So you, those who are very well aware of the strip testing of urine, so they can see it. So altogether the parameters are not in favor of uh, light way of hepatitis, but this is shown very severe level of the hepatitis here in this test. So altogether we have gone through the urine test. So we got it. What is going on with the urine composition, and which one is normal and which one is abnormal? Is there any kind of leukocytes is passing, that is showing here? In fact, the integrated diagnosis takes a lot of time for diagnosis, for proper diagnosis and to the point diagnosis, which will help a physician how he should make a strategy of the treatment in full vigor and in full matters which is collected in favor of the patient. The fact is that physician should be well aware of that his patient should be safe in his hand during the course of the treatment without any mistake and without any hurdles, and when he got cure, that should be very safe. The patient condition should never be in crucial stage. It should be monitored by the physician. Otherwise, what will happen if any condition that meets with the patient, which is very crucial for his health and life, then the physician must be very cautious about the condition and pre-access. That patient should be very safe in the hand of physician. Now you see here the blood which is centrifuged by the centrifugal machine. In the back you are seeing the serum is in upper side and the rest of the hemoglobin is below. So red blood cells are in the mm, in the lower side, and in mid the serum you are seeing. The color of serum is very transparent, but now you see the serum is how we divided in the segregated in the two tubes for the rest of the examination series, the pathological examination. So you see the color of this bilirubin contents is very high after the centrifuge of the blood, and this is the condition which could not be say that this is a very lower side of the bilirubin contents. The bilirubin contents are very high. In this case, whatever the physician is doing, he do for the benefit of the patient and in patient favor, that the problem of patient should be eradicated very gently and in a speedy way. So all the efforts which should be done by the physician should be in the favor of patient. Patient is ignorant about his complaint. He only want to be fit very quickly and depend on the mercy of the physician. Every physician must have the view to reach the benefit of his caliber and his knowledge and his practical experience, whatever he have, and every physician should lend his knowledge in the management and treatment and diagnosis of the patient. Now in the rest position, his parameters are recorded on the monitor which you are looking here. So pulse is 90, his blood pressure is below, his oxygen level and his respiratory rate along with the temperature. So this is the recording of the monitor in the rest position round about we take and record the parameters of the body round about 2 hours, and we take about 8 readings of 15 minutes, and then print all the data and analyze them, what is going on with the rest position compared to, long rest position, which can be say it's a sleep condition. So we compare this long rest and sleep condition to rest position electrophysiography recording and result, and compare with the exercising mode of recording and their results. So differentiation in between the three, we take it. This is the blood pressure 135 by 86, 96 is pulse, and 98 is respiration rate, oxygen level, 13 is the respiration rate, and now this long way of 2 hours and 3 hours or 4 hours or depend on the patient condition, how much time he rest, and what happened during the rest position. So all the records we print it and keep it in our record for the consideration of patient position. So we watch it, and continuous record we see it, what the position happens in the sleep or the long rest condition. So electrophysiography is divided in the three parts. Number one, the rest position electrophysiography recording and its analysis and synthesis. Number two, exercising stage electrophysiography recording and its analysis and synthesis. And the third one is rest position, long rest position, and then its analysis and synthesis. Then we compare all, and whatever we found it, that in some patients the complaints aggravates during the rest position, or some complaints aggravates during exercising condition, or some conditions aggravates during the rest and sleep position. So all the three positions leads to the diagnosis and management and treatment strategies of the patient, and we consider it very seriously in integrated manner, because the aggravation period and amelioration period and normal condition is considered with the patient position in diagnosis purposes. So after considering these all factors and mixing with the results of pathological investigations which we do at our laboratory, and serum tests are done at that time, we consider the liver function test, the lipid test, the hemogram, and other tests whatever essential. We do it all in our laboratory, and we see that